We're back. Today, back with us is Dr. Latashia Hicks. She's a family physician for over 10 years, now working to optimize hormone health for men and women so they can live their best lives. Welcome back, Dr. Hicks.
Thank you so much for having me. It's been a blast. We've talked about so many fun topics, very interesting topics, touchy topics.
It's
been fun.
Well, the touchy topics are the best topics.
Yes.
That's what everybody wants to hear about, are those things that we don't tend to ask our providers. So if we can get a little bit of an intro here on that this is normal. We are experiencing normal experiences with low hormones and fatigue and low libido.
Yes.
And at the same time, what are those questions that I can go ask my doctor? It's really important to learn. And now that you're right here, local, here in Houston.
Yes.
And so everyone can come find you here to answer those questions.
Yes, yes.
So today I would love to talk about, with those hormones in mind, what is the best way for us to get these hormones replaced? So I know there are a lot of different ways. There are some that are more expensive, less expensive, but sometimes the more expensive options are because they last longer.
Yes.
The less expensive are short-lived, and then you still have to spend a little bit of money over time, so it ends up being
About the same
or
more.
And so, right, and so I would love to hear about what are the options, and what you find is beneficial.
Okay. Well, you actually have a lot of options. People have a lot of options. My favorite option, I will say, the one that I think is the best option or that I feel works the best is hormone pellet therapy, or called Bioidentical Hormone Pellet Therapy. Basically, the hormones that are in this little tiny pellet, it looks like a little pill, it's very small, and it contains testosterone, or it contains estrogen in the pellet and in different doses. So based on the dosages, the pellets will be different sizes, and I place them in a pattern that will allow your body to fully get blood flow around the pellet. That one, when you put it in, for women, it lasts about 3 to 4 months, and for men, about 4 to 5 months. And some of the people can go a little bit longer. The more active you are, the faster it'll kind of work, and the less active, the longer it'll last. But the thing is, what I love about it, I call it set it and forget it. You remember the old commercial, set it and forget it. When you put it in, you don't have to think about taking something every day. You don't have to think about doing anything every day. And if you need a boost, all you have to do is become active. Go and work out, go and exercise. And that increased blood flow around the pellets will release more hormone and have you feeling so much better. So I love that option because it helps with compliance. It helps with people who don't want to take a bunch of pills or take a bunch of stuff or have to remember things every day. It's so much better. And also, when you put those pellets in, they start to slowly dissolve. And over a period of months, it just keeps your hormone levels just optimized, just steady. So it's no roller coaster ride. A lot of times, some of the other options that we'll discuss create more of a roller coaster effect.
Okay, so with the pellets, have you found that you can overdo? That's the one concern I've heard from people is, well, if you put something in my body, if it's too much, what do I do?
Right. So yes, that can happen actually. So what happens is that a lot of the things that normally would be the good things, you just have too much of a good thing.
Okay.
If that makes sense. So say for instance, if you have low libido, you may actually have very, very high libido. So I've actually had this to happen to where a couple went from the wife, having hardly any libido to the wife, running after the husband, and the husband's like, "Can you turn it down, please? It's great, but woo, I'm tired."
Maybe he needs to turn it up. Maybe
that was what it was.
That's
actually what it was, because the wife said now he needs to get his hormones optimized, but all of a sudden, he makes sure the wife keeps her appointments. He make sure she comes in on time and everything, but he would not come and get his hormones optimized.
Yeah.
He talked about it, but he hasn't done it yet. But he wants to, but I think he's just a little nervous.
Yeah, well, and that makes sense. It takes a little while.
Yes.
Some people take a little bit longer to get into that space. For someone like that, if they're concerned, if the concern may even be pellet, would one of these other options maybe a good option for him, like a short-lived, maybe we just try. So we have topical, injection, and troches. And troches are the things you put in your mouth.
Right.
Injections we know are needles, and then the topicals we rub on your skin.
Right.
So let's talk about those as well.
Okay. So my second favorite option is called the troche. A lot of people have never heard of that. That is spelled Troche. Some people, you may hear them say troches or something like that, but it's actually pronounced troche. So a troche is just a little square, maybe about that big, very small, that it has basically compounded bioidentical hormone in it, and you put it in your mouth or under your tongue and you let it slowly dissolve. And basically it goes into that circulation that's right under the tongue, because it's a very thin area where it can go directly into the bloodstream, and it has pretty much almost immediate effects. With those though, you have to remember to take them every day. So that's the difference. The good thing about them is if the dosage is too high, you have ultimate control over it. If you feel like you're getting too much, you can skip a day, or you can cut it in half, or you can cut it in quarters. It actually has a score on it that allows you to cut it into quarters, so you can actually change the dosage and adapt the dosage to what your needs may be.
Is it like a lozenge, or what's the material?
It looks like a cough drop.
Okay.
And to me, it's a little softer than a cough drop because you can cut it.
Okay.
With a knife, like you know, you can cut it, but it's not as soft as a gummy. So
Okay.
it's not gummy, but it's not hard either. It's kind of in the middle, like a
Okay.
piece of wax.
Okay, and so you can put it like between your gums and your cheek,
Yeah,
or under
and you
your
can put
tongue,
it under your tongue, yes.
and everything. And then how long does it take for that to dissolve normally?
Usually maybe about 3 to 4 minutes.
Oh, that's not long.
No, it's really quick.
That's
You
not
put it
long.
in there and you just go about your day, you know, after you brush your teeth, or you can put it in before you brush your teeth and brush afterwards. Most of them have like a minty flavor to them to kind of
Okay.
help a little bit. And it's not so bad. Sometimes a little bit bitter because it has medication in it.
Sure.
But, you know, it's not intolerable at all.
And how soon after using one do people feel a benefit?
Oh, usually within hours.
Okay.
Within hours. So they will start to feel it. But if you're starting from scratch, it may take a few days. But once you get it going, you will definitely be able to feel it.
Okay, so then we've talked about pellets. Troche's a way that you could manage the medication a little bit easier, and then we have 2 other.
Yes. So the next option would be a topical. Some people like to get the creams that they rub onto their wrist here, and those are also a good option because you're bypassing the liver. A lot of times, what happens is if you take sometimes there are pills that are out there, but I do not recommend those. The reason why is because if you take the pill, your body will digest it, and your liver will actually process it and break down most of it, so your body won't actually benefit from the full amount. So that's why I'm not so big on pills. The Troche is different because it dissolves and goes directly into circulation, but I'm talking about a pill that you swallow.
Sure.
So the same thing with the creams. When you put them on your arm or you let it dissolve into your skin, it also bypasses that circulation through the liver so that your body can have more of an immediate effect. The only difference is that each person's skin is different. Some people will absorb more than others, and there's no way to determine how your skin will react or how your skin will absorb. So the levels can be a little bit more, you know, hard to follow.
Yeah, so dosing, I'm sure. Is it in a pump or is it in a tube?
Yes, it's in a pump.
It's
so
hard to dose those things, and then and then you might have some in your hand, then you just wash your hands off, and so some of it might have been washed down the drain.
Yes, some of it washed down the drain as well. The other thing that you have to be concerned about with the creams is that it can get on other people. So say for instance, you have testosterone cream on your arm, and then you have a small child. And you're hugging your small child. Well, if it rubs off on your child, then your child can start to have, you know, be getting basically small amounts of testosterone or whatever cream, estrogen, and things like that dosed to them.
Yeah.
And you won't know why, you know, what's going on. And then the child starts to have different issues associated with them kind of growing up a little bit too fast because their hormones are developing faster than they should be. Also, you know, with your significant other, it can also rub off on them as well. So that could cause issues.
How long after someone puts a topical on would you say it's safe to be in close proximity with a loved one? Hold a child, embrace your lover, whatever it might be.
I think let it dissolve for a few hours, you know.
Okay, that's a long time for you to be able to monitor. I'd lose track. I'd be like, I put something on, and then a half hour later, I'd be like, I don't even remember.
Definitely. That's why I would say that's why the creams are not one of my favorite to prescribe. I don't prescribe them very much at all.
Okay.
If a patient wanted that, I would definitely provide that for them, but it's not one of the ones that I'm really into as much.
Yeah, so but you put the creams before, it's still even ahead of injections.
Yes.
So I need to hear why no on the injections or the pluses and minuses.
So the injectables, the reason why I don't typically like the injectables is because all of the injectables are synthetic hormone. They are not bioidentical. So when you are injecting this hormone, your body has to kind of figure out that this is kind of like testosterone, but it's not testosterone. And I can break it down into this byproduct, but it's not the byproduct that your body naturally would make. So now your body has to figure out what to do with that. The other thing I don't like about the injectables is that it creates this roller coaster effect. So the injectable usually lasts only about 2 to 3 days when it peaks out and comes back down. So men may feel that they feel great and then they don't feel good, and then they feel great and they don't feel good. And it's a roller coaster effect. Some men take it maybe once a week, but then you have some people that only take it once a month. And they are really not getting the benefit that they think that they are, because by the time a month comes, that testosterone is well gone, it's gone, it's been gone, and they don't even know why. But the people who are taking it, you know, every few days, they're experiencing the ups and the downs of that hormone, which can lead to moodiness, it can lead to a little aggression, irritability. So it's not my favorite one, but a lot of men are familiar with that one, so they like that one. But a lot of people actually don't like needles.
Yeah.
So that's one that a lot of men I find shy away from, actually.
What do you find? Do you do more pellets than anything else?
I do more
find?
pellets than anything else.
That's wonderful.
And then secondly would be troches.
Okay. Well, that's great. Well, thank you so much for this. And this was really valuable information, I think. So thank you again for joining us here this week.
Yes.
We'll see you again next week.
I would love to be back next week.
So, and please let everyone know how they can find you.
Yes, so if you would like to find me, you can find me at www.exceptionalcareelite.com. Again, that's www.exceptionalcareelite.com. Or you can call the office 713-659-9309. If we are not unable to catch your call, please leave us a message and we will call you back so that we can get back with you and help you to take care of your needs. We also offer telemedicine, so if you are not immediately in the Houston area, we can still take care of you. Also, you can find us on Instagram at EXCARE Elite, Xcare Elite, EXCAREELITE. We would love to take care of you.
Well, thank you so much again for coming. We'll see you next week. And thank you for watching. Please stay tuned after these messages for our next guest.